Welcome to Leisure Time with Anatomy. Today we'll discuss axilla. Axilla or armpit is a pyramidal space between the upper arm and side of the thorax, bounded in front and behind by axillary folds, communicating above with the posterior triangle of the neck and containing neurovascular structures and lymph nodes for upper limb and side wall of the thorax. Axilla resembles four-sided pyramid and presents apex, base and four walls, anterior, posterior, medial and lateral. Apex is also known as cervico-axillary canal. It is the channel of communication between axilla and posterior triangle. It is bounded in front by the clavicle, behind by the upper border of the scapula, and medially by the outer border of the first rib. Axillary artery and brachial plexus enter the axilla from the neck through this triangular gap, hence it is called as cervico-axillary canal. Base or floor. It is the axillary fascia extending from anterior to posterior axillary folds and from the fascia over the serratus anterior to the deep fascia of the arm. Base is the lower end of the axilla and is directed downwards. Anterior wall, it is formed by pectoralis major, pectoralis minor, subclavius and clavipectoral fascia. Posterior wall is formed by subscapularis muscle above, teres major and latissimus dorsi muscle. Medial wall, it is formed by the upper part of the serratus anterior muscle. The lower part of the axilla is defined at the level of the fourth rib. Lateral wall of the axilla is extremely narrow because the anterior and posterior wall of the axilla converge at this site. Anterior and posterior wall converge laterally to the lips of intertubercular groove of humerus, in which lies the tendon of long head of biceps, overlapped medially by the coracobrachialis and the tendon of short head of biceps. Contents of axilla. The axilla contains axillary artery and its branches, axillary vein and its tributaries, cords of brachial plexus, intraclavicular part of brachial plexus, axillary lymph nodes, fibrofatty tissue, axillary tail of breast, and long thoracic and intercostobrachial nerve. Thank you. This is the diagram showing the location of the axilla. It is between the anterior and the posterior axillary fold, and the boundaries of the axilla are shown in this diagram. The anterior wall is not seen. Thank you.